USMLE-style question on type 4 hypersensitivity. Question. A 36-year-old woman presents to the clinic with a red, itchy rash on her wrist that developed 2 days after wearing a new leather bracelet. The rash consists of erythematous, scaly plaques with some vesicles. She has no history of allergies and has never experienced a similar reaction before. Which of the following best describes the underlying immunologic mechanism responsible for this patient's condition? A. Immune complex deposition in dermal capillaries, activating complement. B. IgE-mediated mast cell degranulation and histamine release. Direct activation of complement by IgG autoantibodies. D. CD8 plus T cell-mediated destruction of keratinocytes. B cell activation and production of autoantibodies against basement membranes. CD8 plus T cell-mediated destruction of keratinocytes. Explanation: this patient has allergic contact dermatitis, a classic example of type 4 hypersensitivity. The delayed onset, 48 hours after exposure, and reaction to a contact allergen, likely nickel from the bracelet, suggest a T cell-mediated immune response rather than an antibody-mediated reaction. Mechanism of type 4 hypersensitivity. 1. Sensitization phase. First exposure. Contact allergens, e.g. nickel, poison ivy, latex, penetrate the skin and are taken up by Langerhans cells, dendritic cells. These cells present antigens to CD4 plus T cells, which differentiate into TH1 or TH17 cells. CD8 plus T cells may also become sensitized. 2. Effector phase reexposure. Upon repeat exposure, CD8 plus T cells attack keratinocytes, leading to apoptosis and inflammation. CD4 plus T cells release IFN-Gling, activating macrophages and causing tissue damage. Symptoms develop 24 to 72 hours after exposure, consistent with a delayed hypersensitivity reaction. Why not the other options? Immune complex deposition in dermal capillaries, activating complement. Describes type 3 hypersensitivity, e.g. serum sickness, SLE. Contact dermatitis is T cell-mediated, not immune complex-mediated. B. IgE-mediated mast cell degranulation and histamine release. Describes type 1 hypersensitivity, e.g. anaphylaxis, urticaria. Type 4 hypersensitivity is not IgE-dependent and has a delayed onset, 20 to 72 hours. C. Direct activation of complement by IgG autoantibodies. Seen in type 2 hypersensitivity, e.g. autoimmune hemolytic anemia, Goodpasture syndrome. Contact dermatitis does not involve IgG autoantibodies. E. B-cell activation and production of autoantibodies against basement membranes, seen in type 2 hypersensitivity, e.g. pemphigus vulgaris, Goodpasture syndrome. Contact dermatitis is a cell-mediated immune response, not B-cell mediated. Key takeaways for USMLE. Type 4 hypersensitivity equals delayed T-cell mediated response, 24 to 72 hours. Hallmark conditions: contact dermatitis, tuberculin skin test, transplant rejection, type 1 diabetes, granulomatous diseases, e.g. TB sarcoidosis, mediators, CD8 plus cytotoxic T cells, direct cell killing, and CD4 plus TH1 cells, macrophage activation. Unlike other hypersensitivity reactions, this is antibody-independent. Would you like another question, maybe on transplant rejection or autoimmune disorders?